Nikki. I'll be your nurse today.
Hi.
Can you tell me your name and birthday?
Lori Fussell, 9/10/1974.
All right, let me just wash my hands. So, Miss Lori, what brings you in today?
I had a cough for about 2 days.
Okay. Any chest pain, shortness of breath?
No, just a cough.
Okay. Any sore throat?
No.
All right, so we're just going to do an assessment. I'm going to look at your respiratory and cardiac systems. So the first thing we're going to do is do like a visual assessment of her chest. We're going to want to look at shape and symmetry, as well as a respiratory rate. Look for any type of retractions. Her chest, not barrel shaped. She has normal respirations. They're even and unlabored, and symmetrical movement of the chest. All right, so the next thing I'm gonna do is I'm going to put my hands on your chest. I want you to take a nice deep breath in and out. Good. One more time. I have to go kind of under your breath a little bit. In and out. Good. And that is symmetrical. We're gonna sit up for me. And I'm gonna do the same to your back. Take a deep breath in and out. And we're checking the chest excursion to make sure that she has symmetrical movement in her chest. One more time. All right, and then the next thing we're gonna do is tactile firmitus. I'll start on the back. Can you go ahead and say 99?
99.
Good. Again?
99.
Again?
99.
Good. And then we want to look, feel for vibrations, and they're going to diminish as we go lower. You can lay back. Do the same on your chest. Say 99.
99.
Good.
99.
Good. Okay, thank you. All right, I'm going to listen to lung sounds now. First, we listen to 3 different lung sounds. The bronchial, which is more up to the neck. The bronchiovesicular, which is going to be along the sternum and down the spine. And then the vesicular, which is going to be the rest of the lungs. So I'll be listening to the bronchial first. Take a deep breath. Again. Good. Deep breath in and out. Again. Okay, I'm going to listen as well under here. Deep breath in and out. Good, now I'm going to do the other side. Breath in and out. Okay, if you want to turn and swing your legs on this side, I'm going to listen to your lung sounds. All right, so we're going to listen. Take a deep breath in and out. Good. And the right side has 3 lobes, so we want to be sure to listen to everything there. All right, good. Lung sounds clear. When we listen to lung sounds, you can go ahead and put your legs back up. We want to listen for any adventitious sounds, such as wheezes, crackles, any pleural rubs, as well as stridor and rhonchi. The next thing we are going to do is do a cardiac assessment. So I'm going to go ahead and listen to the heart sounds. When we listen to heart sounds, we want to listen for S1 and S2. We start by listening to the different valves. We'll start at the pulmonic valve, aortic valve. All right, so aortic valve, we listen with the diaphragm first, and we listen to this at the second intercostal space on the right sternal border. S1 and S2 is heard. Then we move to the pulmonic, which is going to be the second intercostal space on the left sternal border. S1 and S2 is heard. Then Erb's point, which is the third intercostal space on the left sternal border. Then the tricuspid valve, which is the fourth, sorry, I got to press a little hard here, intercostal space on the sternal border, left side. And then the last one is going to be the mitral valve, which is the fifth intercostal space on the midclavicular line. And S1 and S2 is heard. After we're done listening to that, we want to listen for any murmurs, so we're going to go back along the same area and listen with the bell of the stethoscope. So the aortic, the pulmonic, Erb's point, tricuspid, and then the mitral valve. All right, and no murmurs were heard. Okay, so then the next thing we're going to do is look at the carotids. We're going to palpate them. Don't do them at the same time. We're going to do each separate one. We're going to want to feel for like the consistency, as well as making sure the rate, that they're not bounding, that they're pliable. Here. Okay. The rate is regular. I'm going to say they're +2 this time. All right, and then I'm going to be checking the pulses. We'll go to the brachial pulses first. We're going to also palpate for consistency, the rate, as well as their symmetry. Okay, brachial pulses are symmetrical, rate is regular, and they're about a +2. Going to do radial pulses. Radial pulses are +2, and they're equal. Then we're going to find the popliteal. And the popliteal pulses, they are symmetrical, and we're going to a +1. When we're moving down to the legs, we want to look for any edema on the lower extremity and the feet. So no edema noted. We are going to take shoes off to check pulses here. Thank you. So we check pulses the posterior tibialis. And they are a +1, symmetrical. And then we're going to be looking, feeling for the pedal pulses. It's best to take gloves off and socks off when we do this. You're going to palpate for them. And they are symmetrical, regular, and a +1.